front desk.
Good morning and welcome to episode 59 of the Cracking Backs podcast with your hosts, Dr. Terry Wyman and Dr. Spencer Barron. How you guys doing today?
Fantastic,
good,
Lance. Looking forward to this one.
Oh, yeah.
So today we are joined by Dr. Jeffrey B. Cantor, an expert spine surgeon. Jeffrey B. Cantor, an MD, has decades of experience in spine treatment and has performed over 11,000 spinal surgeries. As the founder of the Cantor Spine Center at the Paleoorthopedic and Spine Institute in Fort Lauderdale, Florida, his work is internationally recognized as being at the forefront of spine surgery. How are you doing this morning, Dr. Cantor?
I'm doing well, Lance. Thanks for having me.
All right, I'm pumped for this one.
I have to start by just a little serendipitous experience as to how I discovered this great guy here, Dr. Cantor. So I was brought in by a pharmacist at Nova, because I'm on the sports medicine staff at Nova. Remember Lynn Lafferty, right?
I
right,
remember
Jeff?
her well. Yeah, I do.
Right? She says, you have to meet this spine surgeon. I said, oh, I would love to. So we go to his office and we meet, we start talking, we have a great time. He has totally impressed me with two things. Number one, his passion and meticulousness for preparation of a surgery. And two, and first and foremost, which is, well, actually there's three things. Number two was his understanding of improving outcomes by nutritionally counseling a patient. I said nutritionally, not pharmaceutically. I'm talking about nutrition. That's two. And number three, he likes chiropractors, right? Okay. So I leave the place, and who do I call? One of my best buds, other than Dr. Terry, is Dr. Alan Sokoloff, chiropractor to the Baltimore Ravens.
Right.
How? I've known him for so long, right? And I go, Alan, I just met this surgeon, the coolest guy. You know, and I start talking about him, and I mention his name. And what does Alan say? He goes,
I know him.
well, is he about your height or so, a little taller than you and kind of, in good shape? And I went, where are you going with this? He goes, we went to high school
Oh,
together.
my God.
We played football together back about 100 years ago. So, yeah.
How does that happen?
Oh, that's crazy.
Small world. And we just keep crossing paths through a lot of different
that's
different vectors kind of end up crossing in our direction somehow. So,
well, you just happened to mention two of my favorite East Coast doctors, Alan and Spencer. So, this is going to be fun as heck because they're two of my best buds, and I'm all the way over here in California. So this is going to be great.
So I want to diffuse that myth that doctors don't like chiropractors. I disagree. I think that, I use chiropractors. I've had chiropractors work on my neck, and we're all trying to do the same stuff. Our goal is to get people better. And I think good chiropractors are just as good as good surgeons. And, a bad chiropractor doesn't have a knife in his hand. So a bad surgeon is a lot.
That's so true.
So, I think we all got to keep this in perspective that our goal is the same, and we're all kind of, and we can dovetail things together pretty well. So anyway,
I have a great friend of mine named Dr. Chuck Giangara. For years, he was the doctor for the Green Bay Packers. And he was a Curlin Job doc, and he did my first shoulder surgery. And I remember being wheeled into the surgery, and he comes running in going, hey, before you put him out, he's got to get off the table and adjust me. And I was like, and I went, what? And he's like, I slept wrong last night. My neck's killing me, and I do not want to operate you thinking about my neck pain. Well, here I am, butt naked in my little surgical my gown, and I gotta go, oh, okay. And the nurses are looking at him, the anesthesiologist is looking at him. He gets me off the table, jumps on the gurney, goes, all right, get me right so I can do good surgery on you. Well, I guess the anesthesiologist wasn't really pro chiropractic, so I guess there was a big argument during my entire surgery. And the anesthesiologist won because I puked for the next 2 days. But But my surgery,
but that's
yeah, but my surgery went phenomenal. I mean, he's like a great guy, but it was hilarious. He's running in, going, "You guys don't put him out yet."
well,
So,
we have
yeah.
one of the neuromonitoring specialists that works with us is a previous chiropractor. He actually worked for one of the bowl teams. And my neck, I'm operating for sometimes 10 hours a day, and
Oh, I
I'm
bet.
looking down, and I just get to the point where I am just really uncomfortable. So probably about 7 or 8 years ago, I'm just, really hurting. And he goes, "Well, let me, adjust your neck." I'm like, "Who are you?" This guy, and he goes, "Well, I used to be," and this is like the third week he was there. He goes, "Well, I was a chiropractor, and I used to work," and I'm not going to mention the team, but he goes, "I used to work with the ball teams up north, and I'm like, go, have at it." So, I scrubbed out, laid down on one of the other operating tables, and he just goes crack, crack. And I'm like, wow, went back and finished the case. So I was good for 3 weeks.
Oh, that's
So
awesome.
once every 3 or 4 months, I get a little adjustment so I can keep on keeping on. So yeah,
Oh,
it's
that's
my
great
sister gets
stuff.
manipulations on a regular basis. And again, there's roles for each of us. There's definitely things that you do that I don't do and vice versa. And I think that if everybody realizes that, as long as we know when to hand off and we know
Yeah.
when we're in our lane, that's really when things tend to work well. Anyway,
That's awesome.
No, that's
No,
great.
that's the
And
stuff we need to hear. Yeah.
so, Dr. Jeff, let me ask you, how did it all start for you? I know this is an outstanding story. So, how did how, how did surgery become part of your lifestyle?
well, it started out when I was I actually am about your size, and obviously you work with professional football players, and you look at those guys and you're thinking, well, that's obviously not something I'm going to do. But like most idiots in high school, I thought I was going to play ball. I was 5'8". I was a pretty good ball player. I had a lot of bad injuries, and I had one really serious injury. I dislocated my knee as a senior in high school, and I was really along the track. I'm going to go to high school. I'm going to go to college and play sports and that sort of stuff. And to the point where we really didn't focus on anything else. And I was telling you yesterday, Spencer, when I was in my senior year, it was the early part of the year. We were playing football and we had the SATs. And I grew up in a blue collar town. We didn't know what the SATs were. We didn't care what the SATs were. Now you look at all these kids and they get tutors for $500 an hour so they can get 1 point higher on their ACTs or SATs. But I remember we were taking the SATs the morning of that. We had a pretty big football game, and the game was supposed to start at 3 o'clock versus 1 o'clock, and it started late, and we're kind of into this test, and we have one more part of the test to go. And I'm looking at my watch, and it's getting kind of late, and there's 3 of us there that needed to go, and we look at each other like we're out of here. So I got up and walked out of my third part of my SAT and left and went to play a football game. So, I did well in school, but it wasn't anything that I cared about. So, and I was looking at college football scholarships and things like that. And then I got exposed after having that bad knee injury to a bunch of doctors at the Temple Medical School emergency room. And I went over there, had a bad injury, and I was, spending lots of time there. And I was in the emergency room there, and I'm watching all these guys, interacting together, and this team of doctors that took care of me with a bad problem. And I was like, wow, this is kind of cool. And after that, really spent a lot of time with these guys, and got very interested in not being a football player, but being going into medicine. And that's really how I got interested in that life change. And I had no interest prior to that. So
That's interesting.
then it became almost an obsession. So
Was there body parts that you were interested in taking care of other than cervical spine? Like what came in the very beginning?
well, I had 3 bad injuries in high school. It's crazy. The very first year we played high school, we had a good football team. I was a freshman starting tailback. And my sophomore year, we were supposed to do really well. And I stepped in a hole on an irrigation system on the field and tore my Achilles tendon,
Oh,
missed the whole
wow.
year.
Wow.
Oh my.
Um, the year after that, I was obsessed with fitness and was squatting ridiculous amounts and came back. The Achilles tendon healed, and in the first half of the season, working out, I herniated a disc in my back
Oh,
and
Wow.
missed part of that season as well. Came back again as a senior, was doing really well, had a knee meniscal tear, minor injury, had an injection of painkiller into the knee. And I didn't realize then you probably shouldn't inject painkiller into a knee and then go play football the next day. It was actually done by a real sports doctor, and dislocated my knee in the football game.
Oh
So
my God.
all of these things kind of led up to multiple injuries, but the actual spine neck surgery didn't happen for almost 25 years later is when I really got specialized in neck surgery, and that's again a different story. But I had a lot of I've been on the wrong side of the examining room way too many times. I've had a total of 15 surgeries, so I have a very different perspective
Holy
when
crap.
you go to the exam room, and I think you should have to have a spine operation before you're allowed to do one. But that's
Interesting.
just me.
Yeah.
How did you decide to? Oh, sorry,
No, go.
Terry. You wanted to
Well,
ask?
no, go ahead, because yeah, I'm going to take it down. I want to ask some questions about what's currently going on. So go ahead.
Well, hang on, because I wanted to ask him
Yeah.
about what made you decide to implement nutrition as a protocol in surgical prep, or prior to surgery.
What's interesting is that there's years ago, in the early part of the practice, we're talking about 30 years ago, we would, back then we really didn't pay a lot of attention to it. I had a doctor when I was at Jackson, Patty Byers, who used to always push knowing how many, protein calories are in an egg. And honestly, we thought this lady was crazy. And nobody paid any attention to her. Honestly, it was a total pain in the ass. Listen to that stuff. We had to listen to her. We had to but she was 100% on. She was right. And you know what? As you practice, good days are great. Bad days are learning opportunities. When
Yeah.
something doesn't go well, you need to pay attention to that. When you have an outcome that's fantastic, that's great. Everybody pats each other in the back. But when something doesn't go perfect, I mean, it doesn't go perfect. You got to pay attention to, why did that suture spit out? Why is there a tiny little abscess at the bottom of the wound? It really isn't a big deal, but what the heck just happened? And why did it happen? And let's figure out a way to not let it happen again. So early on, we were seeing, we do big operations and we get wound infections. And the first thing you do when you get a wound infection is you try to get what's called wound control. And wound control means you need to get the person so that their body can recover from that, so they can overcome the stress on the immune system to really be able to start healing a wound. And I had also some really interesting people that trained me. One guy was named Bill Burkhalter. Bill Burkhalter and Tony Ballard was also one of my old professors. These guys started the MASH units in Korea and in Vietnam. So these guys were amazing wound healing specialists. So really had a good understanding of how to manage significant wounds. Now, we don't see those kind of wounds anymore, but I think in training, it's really important to be exposed to truly injuries, kind of like war injuries. So again, nutrition, getting these people to where the body can manage the bacterial load, can manage the need to get successful in that process. So as I'm dealing with these injuries, the first thing we're doing is, okay, you need to get the wound clean, you need to wash it out, dressing changes, things like that. But in addition to that, we would start pounding calories, fat calories, protein calories, and phytonutrients. These big big yellow banana bags would have all the vitamins that we would give these patients. And you would see people that are not thriving. And we would start to kind of get a foothold, and you'd start to see them recover. And it was complicated. It took sometimes 2-3 weeks to get somebody where that wound really started to be managed better. So what I started to do about almost 15 years ago, and that's a little bit before I met you, Spencer, we started to say, well, if we're trying to get these people to get better by controlling their nutrition, why don't we start doing that before their operation? Why don't we start protein loading? Why don't we start phytonutrient loading? And why don't we start getting people in a situation where they can recover from wounds without having to try to do it in retrospect or trying to chase our tail and catch up. So we really started looking at nutritional needs, what the body needs in a normal day versus what the body needs after a stressful situation. And it's interesting, the body needs about a half a gram of protein per kilogram of body weight to get through a day for an average person. So if you're 70 kilograms, you need about 40 grams of protein to get through your day. And by the way, that's not that much. That's a can of tuna fish is about 30 grams of protein. So you have a can of tuna fish and an egg, you got your 40 grams of protein. But if you're stressed, you need as much as 2 to 3 times that, which is what I was initially trying to get people up. Okay, we're getting people preoperative for 4 to 6 weeks out, pounding protein and simple, because if it's not simple, they're not going to do it and it's not going to be successful. So we were protein loading. And in addition to that, we got to understand nutrition, understand that protein by itself doesn't do much. Protein needs to form tissue. And to do that, you need phytonutrients. And phytonutrients are obviously vitamins. And vitamins, the best source of vitamins is vegetables. So we really started pushing natural supplements, freeze-dried vegetable probiotics, prebiotics, all this sort of stuff. And we really started to see that we were doing this. We literally can tell which patients were following instructions by looking at their wound a week after surgery. And we got almost 100% compliance. Patients are losing weight, they're feeling better. And I've got people that have been doing this for 15 years and are still following the same routine, and they feel better than ever.
That's awesome.
The number one most common reason for a post-surgical wound infection is pre-surgical nutrition. It's fixable. You can correct pre-surgical nutrition. So when you've got people that are worried about an operation and they're worried about complications, you need to engage them. You need to say, well, there's certain things that we're going to do, but if you look at the most important thing you can do, it's nutrition pre-op. What's interesting is I don't want to mention any names, but back when I was in training, I had 2 professors that I worked with. And one professor had a very advanced kind of mature practice. He was very selective about his patients. And another guy was relatively new. So the guy that was relatively advanced had a little younger population, skinny people. Everybody was coming from a population where they were fit and thin. And he just didn't like to do operations on bigger people because it's just much more complicated. And the other guy had a population where he had a lot of folks that just didn't take care of themselves, a lot of morbid obesity, a lot of folks that were smokers, terrible diets, cheeseburger type diets. And the guy that had the population of really fit people used to go up to the scrub sink, put his hands in, wash, and literally almost used to wipe it on his shirt and go do an operation. And the other guy used to scrub and put bactericide up his nose. I mean, this guy was obsessed with sterility. And the guy that wiped his hands on his shirt never got an infection. The guy that scrubbed everything got infections all the time. And it wasn't his hands clean, which, by the way, is important. It was the people that he was operating on were nutritionally prepared. And that's a real long answer to
it's great.
To a question, but it's incredibly important that people prepare for an operation like they're going to prepare for anything else in life that's important.
He doesn't sound like a chiropractor, does he? I mean, he doesn't sound like an orthopedic surgeon, does he? He sounds like a chiropractor.
There's another orthopedic surgeon that works out at BYU called Dr. Kurt Kimball. I don't know if you've ever heard that. He started an orthopedic surgeon that started a nutritional company called Forte. And he changed it to a medicinal company, and because it was a nutrition all based on diagnosis. And he made a pre-surgical shake, because he said the same thing. You got to get the right nutrition. Most orthopedics don't want you to do anything because of magnesium or different bleeding disorders, but he would find out what would reduce infection. And then he made a post-surgical shake to reduce that 5 to 10% of infections as well. And here's one until I heard you, he's one of the first orthopedic surgeons that was really on to the research of nutrition pre and post surgical and for specific conditions. And I thought that was, so what you just said resonated with him a lot as well. Another very forefront orthopedic surgeon guy that was really working. He worked with BYU. So I don't know if you ever heard him.
Well, I've heard a name. Probably the first article that I've ever seen was written by, I think it was Neil Kahanovitz. And Neil practiced in the Northeast. And he wrote an article looking at major complications in operations, looking at factors and what the factors were that led to somebody having a really bad outcome. We're talking about major complications, mortalities, and things like that. And basically, it came out to two basic factors. Number one, pre-surgical nutrition, and was the total lymphocyte count, albumin, pre-albumin, things that are more lab-based, but basically they assess nutrition. And number two is the training level of the surgeon. And the more advanced, the more fellowships, the less likely of major complications. Interestingly, years ago, in the heart surgery space, general surgeons used to be allowed back in the 40s and 50s to do heart surgery. And because of the advance in training, there became a specialty of cardiothoracic surgery. And what happened was they started looking at mortality rates and major complication rates, looking at the heart surgeons versus the general surgeons doing hearts. And they pretty much found that the difference is really statistically very significant. And you're much better off even waiting for the heart surgeon to show up in a trauma center versus letting somebody who's not trained mess with your heart. And the same type of research and retrospective research was looked at with levels of training in spine surgery. And they pretty much found that general orthopedists, general neurosurgery really have less good outcomes than either orthopedic or neurosurgery that has had additional fellowship training. But the difference is not a lot of mortalities. Politically, it's been very complicated. Having folks that have done spine surgery all the time, orthopedists and neurosurgeons without specialty training, say, okay, you can't do it anymore. So it's really never gotten a foothold. But the reality of this, there's studies that show that the more advanced training, it's not orthopedics or neurosurgery, it's how far after you did your neurosurgery and how far after you did your orthopedics did you actually continue your training. And that's called fellowships. Now, people know I go to a general doctor versus a cardiologist. Well, if you have a heart problem, who are you going to?
Right.
Cardiologist. So if you have a spine problem, you can go to a general doctor. You can go to a cardiologist of a spine. And a cardiologist of a spine is a general orthopedist or a neurosurgeon that's done additional training. And usually it's 1 to 2 years after. But anyway, that's
interesting.
Lots of complications and factors. And the number one thing you can do as a surgeon is make sure you don't screw it up. And it's important to have. Again, I've been on the wrong side of this. When you go into an operation, I know that it's only part of the operation is what the surgeon does. A big part of it is the preparation and understanding what you have to do to be successul.
Hey,
Anyway,
Dr. Jeff, I do have a question. Part of our podcast was going after anybody to improve people after the last couple of years, mental, physical, nutritional health. What, as a spine surgeon who thinks the way you do, especially a neck, and nutrition, what have you seen dramatically change in the last couple of years? You have the text neck, you have all this kind of stuff. What are you seeing as far as the health of the patients coming in? And are you seeing anything different, any conditions different? Are you giving any different advice? What are your thoughts on the last couple of years from your standpoint?
My practice is really complex neck stuff. I do cervical stenosis, OPLL, things like that. I take care of pretty complicated neck problems. We do some simpler stuff, but I don't take care of a lot of neck aches. So a lot of the stuff we do is severe core compression, neurologic loss, things like that. So as far as do I see stuff from tech neck? Not really. That's not my space. Telemedicine has really changed what we do a lot because it used to be very difficult to get access to doctors remotely. Our practice was about 30% patients from out of state or out of the country before the pandemic. And since the pandemic, we're almost 60% of our
Oh, wow.
patients that are having surgery are not local. And probably if you look at travel distance, greater than 80% of them are from over 100 miles away.
Oh,
So
wow.
we probably only 20% of the patients that we see, because we're so specialized, and because we do complicated neck surgery, are traveling from quite a distance. Our most common geographic areas are actually Los Angeles and New York City.
That's
That's the
fantastic.
most common procedures that we do. So what else have we, what's changed technology wise as far as from a technique standpoint? The thing that I think that has really been the paradigm changer in the last 35 years that I've been doing spine surgery, and I've seen a lot of different color screws and a lot of different ways to put a screw in. And I literally tell the reps, I say, don't come into my office with a screw that's just painted a different color and telling me it's different. Still does the same darn thing. And I'm not interested. And don't come to my office with a robot that puts a screw in that I already know how to put in, that I'm trying to figure out a way to not put in. So
that's a key point.
That's a key point.
You got to bring that up. That's a key point. That go ahead. I know where you're going with this, but that's really a good.
Yeah.
The reality of it is, the spine surgery with really good intention has and by the way, spine surgeons help a lot of people, and there's a lot of people in this world that are in a much better spot because they got past the point where they can be treated with therapy and chiropractic and medications, and got to the point where they were in trouble and they needed help. And quite frankly, even the older techniques that I feel are, in my mind, not the way that I would let somebody work on me, are still helpful in a lot of people. But at the same time, I think what some of the new technologies have allowed us to do is to look at this through a much different lens. And in a very basic, conceptually, the spine is basically made up of certain structures, and these structures hold us together and keep us upright. Basically, you have bones that stack on top of each other, which is like a compression column. The body weight sits on them. And those bones are only really stable when the body weight is sitting on them. And I don't have a model to show you. But basically, the front of the spine, the vertebral bodies and the disc is what carries our weight. And in the back of the spine, you have arches, covers that are attached to these cables. And those cables is like the cable on a crane. So a crane, you've got a big metal boom, you got a ball that hangs down with the weight on it, and you have cables on the back. And if you cut those cables, what happens to the ball? Ball ends up on the ground, okay? Well, the spine is basically that big metal boom with cables in the back. Now, the problem is the cables are covering this channel that the nerves go through. And the arthritis and disc herniations and stuff that afflicts spines grows into those channels. Well, you have to get to the nerve pressure to fix the problem. And in the process of doing a very good job getting to the pressure on the nerves, you have to take structure out. And taking structure out means that you have to alter the cable system. You eliminate it. You cut the cable on the crane. And then when you do that, you completely alter the mechanics of how the spine is made. You disrupt the normal physics of how the body works. And you guys as chiropractors, that's what you do. You look at what's the physics of how the spine works. So if you alter that with good intention, there's consequences. Now the mechanics, the way we move now starts to cause, instead of compression, it's tension, and things break. So you start having one problem after another problem after another problem. So I've really been looking at this for years because I've had laminectomies, I've had procedures, and my back structurally is having changes as a result of that. So I started looking at this as, again, the same thing. When you have a problem, what just happened? And old-fashioned laminectomies, particularly in the neck, and I love neck surgery. Neck surgery is like fixing a watch. Low back surgery is like fixing a diesel engine. They're very different.
Oh my God, that's a great analogy.
They're tiny versus big hammers and saws.
Yeah, great analogy.
I like fixing the watch.
Yeah.
So when you look at old-fashioned neck surgery, you go in the back of the neck, you take all this stuff out, and you say, my God, we're doing a great job. We're keeping people from becoming paralyzed. And a year later, their head's down like this. They can't bring their head up, or they got 16 screws in their neck. And they said, Doc, I wish I never met you. And you say, well, you're walking. And quite frankly, they don't even remember that they weren't walking. You do operations on people, they come in, they can barely move. You fix them, they're walking 3 weeks later. And 2 years later, they come in still walking and their neck hurts. They said, I was fine before I met you. I'm like, I've got videos that you weren't fine. But you know what's interesting? As a physician, you need to pay attention to that, because if 2 to 3 years out, they said what you did sucked, it sucked. Okay. So I really started looking at, okay, why does it suck? What are we doing to necks that's screwing it up? What are we doing that's altering their mechanics to the point where they can't live their life again? And really started to forensically look at, okay, tension bands, what's attached, what's important, what's not important, and really started to make some real anatomical changes as far as the way we think about this. And quite frankly, none of this is published, and it needs to be. I just don't have the time to do it, but I'm working on that now. And looking at, okay, what are the mechanics that's absolutely necessary that you need to preserve, and what are the mechanical structures that you can alter? And if you preserve these structures, how do you do operations to get around the needs before? So what I started looking at is ways to work inside the spine and preserve the ability to maintain those cables. And this very long story goes back to what's the difference in technology. And the traditional way that the tools that we use to remove pressure on nerves are like Dremel saws. They're drills, they're sharp, they spin. You touch them to a balloon or something delicate, it's going to rip it apart. Yeah. So you've got to be very careful working in tight spaces, which means you need to make big holes. You need to make a lot of room working in those areas next to delicate nerves. So years ago, I used to work inside the spine with these tools that are a little bit dangerous near these tools. And my PAs used to tell me, I get chest pain watching you stick that drill in next to that nerve. And I'm thinking to myself, I get a little chest pain when I do that too. And then about 9 years ago, a new tool that came out that uses vibration. It uses high frequency vibration on a almost like a butter knife, that the energy from the vibration essentially dissolves the bone, almost like a hot knife will melt through butter.
Interesting.
And that tool is called an ultrasonic scalpel. The brand is Misonics. And I saw this tool kind of in passing and played with it. And it's not easy. It's very powerful. It cuts things easy. It's one of these things where I'm like, wow, that's really cool, but it's going to take some work to figure out how to use it.
You better tell that story.
And I'll tell that story. So,
okay.
Anyway, so I'm still doing my thing, and my PAs are still getting chest pain, and I'm still getting chest pain. And I mean, this is, how painful is this to you to listen to me telling all these long stories?
Oh, this is awesome. I love this.
So, it was probably about 8 years ago, and it was Memorial Day, and my wife I had surgery. I couldn't leave town, and my wife gets called from one of, for her brother, and they want to go to Dallas to go to one of these amusement parks to ride some roller coasters. And my wife's mom is probably 70 something. She still likes roller coasters, which I think is a terrible idea, but that's what they wanted to do. So, and I'm thinking to myself, I got a hall pass. I'm going to go out and get on a bike and do a long ride. So they're in Dallas. I get up in the morning and I get on a bike with one of my buddies who's a beast, and I probably shouldn't be riding. I'm a pretty strong rider at that point. And we hop on a bike and we ride all the way up to Palm Beach, probably 45 miles up, 45 miles back. And on the way back, we had probably a 30-mile-an-hour headwind. And I get back to Fort Lauderdale and I am fried. And I had 2 fingers on my handlebars, and I pick up water and I'm drinking the water, and I touched his back wheel and jackknifed my bike, flew over the handlebars, and you can see this big scar here is what the result was. So I'm looking at my hand and my wrist is up by my elbow. Holy crap, I am full on screwed.
Oh, I
And
think you're more than full on screwed. I think you're
oh,
fucked.
I was full on screwed. So, yeah, fucked is the word that I was. I don't know if you're allowed to say that on a podcast, but I was fully fucked. So anyway, it's Memorial Day, 10 o'clock in the morning. I tell my buddy, I says, grab, and I literally, my hand was like, I grab my wrist, I pull it forward and reduce it. So I got the hand, I'm holding it out. And interestingly, it didn't hurt.
Huh.
I'm holding it. It's really, this point in time, it's not even hurting. So I say, take my phone out of my pocket and dial this number. So he calls my buddy, who's a hand surgeon, and he goes, Jeff, I am halfway up the turnpike heading to Disney World with my kids. And I said, Jose, and it's Jose Jackson. And I said, Jose, you gotta help me, dude. I'm in trouble here. He goes, I'm coming back.
Oh.
I said, I will pay for your Disney World trip. He goes, no problem. I'll pay I'm coming back. So turns around, comes back, and then 2 hours later, my wrist is fixed. So during that time, my wife calls, and the nurse who's in the OR, I'm kind of sedated. She picks up the phone, says hello. My wife hangs up the phone. And my wife isn't a jealous type at all. Matter of fact, probably not jealous enough. But anyway, so she hangs up the phone and asks, what the heck was that? And then I'm having surgery for the next 2.5 hours.
Does
And
your
then
wife
I'm
know
waking
you're
up.
hurt?
No.
Oh God!
I didn't want to tell her that I broke my arm and I'm having surgery. Because I'm not going to screw up their day. I mean, my day is totally fucked, but I'm not going to screw up her day. So, and I'm doing this for good reasons. I want those guys to have fun. So, anyway, she keeps calling and calling and calling. And I do the surgery, and I get one of my buddies brings me home, and his girlfriend and him are over there taking care of me. And I'm waking up, and I'm on my couch sitting down. And once again, now it's about 9 o'clock at night, and this first started around noon. And my wife calls, and his girlfriend answers the phone.
Oh,
and she goes, hello. And he goes, this is Jeff's wife. Who's this? And I actually can't even remember what his girlfriend's name was at that point. And she gives me the phone. My wife goes, what the flip is going on over there? I said, he goes, well, it's kind of a long story. And she goes, well, you better start talking. What's the long story? I called you before. Some girl answers the phone and hangs up on me. Then you're gone for 8 hours. Then another girl answers the phone. What's the issue? What's happening? I said, well, I fell off the bike, broke my arm, and I had surgery. She goes, you did what? And she goes, why didn't you call me? I said, well, I don't want to screw up your day. So anyway, so the
how long have you been married at this point?
Well, we've been together for a long time, 23 years, and my wife's awesome.
Yeah.
I'm pretty darn lucky. I got a good wife. But anyway, the next day, I kind of wake up and I go, this is a problem. I can't work for 3 months. Yeah. And I've got, some real issues. So it's Sunday now, and I call up the guys that had invented the Maser robot. I don't know if you guys know anything about Maser robotics. It was probably the first spinal robot. And I hop on an airplane on Sunday, and I go up to Orlando, and I spent 2 days working with the Maser robot. So I figured I got to make some, make use of this time.
Right.
So I went up to Maser, and it was early. I wasn't, I'm thinking, I can put 2 screws with this tool this time, and it takes me about 3 times as long as to do it normally. It doesn't really add any value at this point. So I'm like, not that excited. By the way, it's come a long way since then, so I'm not knocking the tool. It's a useful tool at this point, particularly for complicated surgeries. So, but at the same time, I'm like, I really want to spend some time with that MySonics tool. So I called MySonics. I told them, I've got a cadaver lab in my office. We developed product. There's been actually the Mako robot. This the first knee robot in the world, was developed in, all the testing was done in the second floor of my office.
Wow. Cool.
And I talked to MySonics. Stavros, as a CEO, sends me 2 units, and I got 3D imaging. I've got all these tools to start playing with this technology. In a cast, I got one arm in a cast, and I'm working with this thing. And I spent 3 months every day in a lab learning how to use this tool.
Wow.
And literally, talked to a bunch of engineers who developed ultrasonic strobe lights, and we put it under microscopes. And I was watching how this tool cut through an egg, how it cut through bone, how it worked on plastic, how it handled on nerves. So I knew more about this tool than the people who make it.
Wow.
So I really spent an enormous amount of time understanding, what is this thing going to do in somebody's body? How is it going to behave? Where is it safe? Where is it not safe? How does it have to be moved? And I really got good at it. And, if you're going to do something, damn it, be good at it.
Yeah.
And so while I was doing that in the lab, they were developing the Mako robot. The Mako robot back then was owned by a company called Mako. It was subsequently bought by Stryker for about $2.5 billion. And one of the investors was watching me pretty regularly. He'd come over looking at the robot. He was down from Boston, and he was the lead investor, and he would watch me, and he's watching me, and I'm looking at him, talking to him. I introduced myself, and he introduced himself, and I won't mention any names. But he was fascinated by this whole process of ultrasonic surgery, and we're working inside the spine and not taking the covers off, not doing laminectomies. And after about 2 months, he comes up to me, he goes, how many of these have you done on a person? I said, well, my hands did a cast. I haven't done any. He goes, well, as soon as you start doing this, I want you to fix my father's back. And I said, well, I've never done it. He goes, well, I've seen traditional operations many times. I've watched it. He goes, I want that. And he goes, when you start doing it, I want you to do. And actually his dad, and this gentleman was the chairman of the board of a major medical school. Everybody knows it. And again, I can't mention the name, but you'll know who he is. So he sends his dad, and the first operation that I did was his father, and I subsequently have done 3 other relatives. So the broken arm gave me the opportunity to up my game, and it's been a game changer. I've never gone back and done a traditional spine operation since then. And that's really, and so the long and the short of it was the ultrasonic tool has changed the entire paradigm of how you do spine surgery. We can do procedures from the inside out. We can do structures that completely save the normal tissues. We can rebuild backs without altering the structure. They can go back and have manipulations later. They can go back to pretty normal activities and normal function. So we're doing folks that have 6-level neck fusions that have normal function, normal motion when they're done. So that's why people get on airplanes and travel. We recently did a gentleman from Africa. We did a guy from Singapore. We see people from Korea, Middle East, Israel, and folks there's good doctors there, but this is a new technique. It works. We're training additional people to do it, but it's not easy. It's going to take somebody an investment of hundreds of hours to learn how to use these tools in that tight environment. But once they do it, it's going to change the outcomes of their patients in a way that's very positive.
Wow.
So, just
is this stuff interesting at all?
Oh, hell yeah. I'm fascinated.
I love this stuff. No. Serious, Jeff.
Yeah.
I love yesterday you mentioned something about how misfortune can become fortune.
Yeah.
You summed up your life and your transitions from football to conventional surgery to this high tech approach. Remember you said something about that yesterday on how.
As I mentioned earlier, I think that the bad days, the opportunities to improve are not the opportunities when things go well. The opportunities to improve is when you're introspective, when you really are critical of what you do and anything you do. I mean, football players are, my wife was doing a design job, and oh my God, my brain, I forgot the name of the, and we all know who it is. Was it Marshall Falk?
Yeah, could be.
I think it was
not Brandon Marshall.
And again, I don't know, but I think it was. And I remember her talking to him, and I was watching I don't know if it was a Football Life or something like that. And they said, listen, you've done everything thing you can do in football. Your talent is ridiculous. Your cuts, your reads, and there's really not much else that you can do. And what he pretty much said was, they said, what makes this fun for you? Why are you still doing this? And he said, I study film and I look at what I did well and I ignore it. And when I study film, I could have planted my foot 1 millisecond faster or in a different direction. And I could have made that cut and avoided that tackle. And he goes, that's my obsession, is to take what I did not avoid that tackle, and that's my opportunity. And I think that's really when, as a surgeon, you need to look at, okay, I've got a great outcome versus a good outcome. A good outcome is not a great outcome. How do we make it great? What do we do to avoid problems, avoid risk, to decrease problem rates? And I think that is what makes this fun. And that's really what almost to the point of being obsessed with what just happened. Also I think I was telling Spencer yesterday, had a really interesting guy who actually we're traveling with this weekend, who ran a very successful auto part manufacturing company. And he was probably the biggest privately held auto part manufacturing company in the United States. If you have a car, his parts are in it. And back in 2008, 2009, there was about 125 plus auto manufacturers. And after the whole industry went to hell, there was probably 15 or 20 left. And here's a small company that went from one of over 100 to one of the top in that 20. And we were at his apartment. My wife designed one of his penthouses, and we're sitting down drinking way too many scotches on a Sunday afternoon brunch. And we're talking, and this guy, I don't think he ever went to high school. He is brilliant. And he's one of these guys that you just need to listen to him. When he talks, pay attention to what the hell he's saying. So I said, Wayne, how did you go from the guy that went from one of many to one of few, and absorbing the many at the request of the auto part manufacturers, of the auto manufacturers? How did they pick you? He said, well, Jeff, he goes, it's interesting. He goes, it's all about error rates. It's all about being different. And in the auto industry, you're allowed to make one error per million events on the assembly line, or roughly, just for argument's sake. So when you make a mistake, the assembly line shuts down, and they know who made the mistake. So you're allowed to make about 1 in a million. So what I did is I developed systems that make the error rate for my products 1 in 3 million. They're not going to screw up because of me. And what that did is it made the auto industry start paying attention to him and start to realize that this guy needs to start taking over these other companies, and this guy needs to train these other people how to not screw us up. I went and listened to this conversation, went back and started looking at error rates in medicine. And there's a lot of reasons for errors in medicine. The number one biggest reason for errors in medicine is the mandated electronic medical records. Things are missed and lost. It's a disaster. It's been a disaster since it started, but that's a different issue. But we also talked about the commoditization of medicine. He goes, if you're doing a appendectomy, there's 60 other guys that can do the appendectomy as well. And there's no difference. And the reimbursement and the price for that appendectomy is now a commodity, and it's negotiated, and it's basically traded like you would trade the price of wheat. Exactly, it is. And that's the problem with medicine. He goes, if you're going to survive in this market, you better start figuring out a way to make yourself doing something different where people are going to seek you out. And that way you can maintain a practice that is enjoyable. And that's one of the other things that I really looked at as a game changer for me, because we really started looking at error rates. And back, we talked earlier about nutrition, and we talked about preventing blood clots, and we talk about, I have systems in the office that we have patients go through a completely separate, in addition to their medical clearances, they go through a completely separate process of looking at a lot of details that might be overlooked by the primary doctors. Some people elect not to do it. I think it's crazy because it really does pick up things that are missed. Anyway.
No, Jeff, that's such, such important information and understanding where we can continue to get better no matter how long we've been in practice, and create a paradigm shift in healthcare, whether it's a surgeon or a chiropractor or acupuncturist or whatever.
Anything, yeah.
But, I got to tell you, Jeff, I watched your YouTube video on, Dr. Jeff Cantor's cervical stenosis.
It was brilliant, by the way.
Man,
yeah.
Well,
yeah. You know why it's brilliant? I'm going to tell you why it's brilliant. Because you don't talk over anybody's head.
No.
And you got 3 million views because you speak English.
It was great
to people.
It was great.
You make it really simple and basic, man. And I
thank
really
you.
love that you do that.
Well, it's interesting because people just want information. I mean, I can talk over your head and you can talk over my head, but what good does that do you?
Well, it's really easy when you're 5'8".
What I am. What's that?
It's easy when you're 5'8". When you're only 5'8", it's easy to talk over your head. Yeah.
So yeah, it's I think that comes down to having been in the chair on the wrong side of the room.
Yeah.
Yep.
And I can't tell you how many people come into me, and again, this is another opportunity from, when bad things happen, to try to make some chicken soup out of chicken shit. And I think that when people come into me all the time and they say, I've seen 7 doctors and I have no flipping idea what's wrong with me. I mean, or in that video, the first thing it says, my arms are numb and I don't know why. And somebody says, I got to go to the hospital now. And somebody says, wait till you can't walk. What the heck's going on? I don't know what's happening. So what I did is I basically said, I'm going to make a video that just clearly explains what this problem is. And it's Jeff Cantor cervical stenosis. And it's actually been out for years, got over 3 million views.
Yeah.
And what it does is it, in very clear, probably too long, but in very clear language, tells people this is what this problem is and this is what you should do about it.
Yeah.
And it's educational. People just want to know. People just want somebody to tell them the truth and be able to get something valuable out of that experience. So,
Jeff, with that said, we do have to wrap up right now, but I am telling you, if anybody who has those kind of conditions, after you've seen your chiropractor and it's not working, check out cervical spine stenosis on YouTube, Dr. Jeff Cantor. It is, the way you describe everything is fantastic. I think you did a really good job taking, that's what I call genius, highly complex, and make it into bite-sized portions for the average person to understand.
Yeah.
But Jeff, I really thank you for being here. Plus, we need to get together, especially when Alan comes down into town.
Absolutely.
Hey, when
maybe we could persuade Terry to come into town.
I was just going to say,
Professor, if you want to come to Florida, let me know.
Well, Dr. Jeff had me a scotch.
What's that?
Dr. Jeff had me a scotch. So when you had me a scotch.
Well, I've got some of that.
Yeah,
I've got plenty of that. I got a bottle of blue sitting on the table over there.
Oh,
so
there
you're welcome to it.
Oh yeah. So I have a thing called Axe and Whiskey Night. So the fact that you had me a scotch, if you can get Alan down, I'll be on a plane and the 4 of us are gonna hang out. This is great.
That's so great.
I am 100% up for that.
Beautiful.
So,
well,
guys,
thanks
so much for having me.
Yeah, man.
Hey,
thanks a lot.
You know what? It's a pleasure and an honor to meet you, Dr. Jeff. And I do look forward to meeting you and hanging out with you sometimes. So, and you know what? Your profession should be very excited and proud to have you in it. That's pushing it to a great positive level, and a guy that can take adversity and keep changing it into a positive mode. I hope I can follow in your footsteps without breaking my hand. But, if it happens, I'm going to turn it back to that story and it's going to get me through. So I appreciate everything. Yeah. All right, my friend. It's nice to meet you. Thank you for helping others out there. So good on you.
Okay. Thank you, Lance.
Thank you for listening to today's episode of the Crackin' Backs podcast. We hope you enjoyed, and make sure you follow our Instagram at Crackin' Backs Podcast. Catch new episodes every Monday. See you next time.